Hey guys, I hope you guys are all doing well. Today we are going to talk about oral health risks associated with swimming. Swimming is one of the top 5 most enjoyable activities across the United States. Some people grow up swimming, find it as a hobby, and also compete in swimming as a sport. Many people that swim do not know or understand the oral cavity and how it is impacted by swimming, so it is important to educate patients who do swim about these risks that come with frequently enjoying the sport of swimming. Today we're going to talk about 4 main points that are the oral health risks associated with swimming, which are tooth staining, calculus buildup, erosion, and dental pain. Tooth staining in swimming is the discoloration of the front teeth due to the chlorine in the pool. Pools contain high amounts of chlorine and other added antimicrobial products that have a different pH than neutral saliva. It's an acidic pH. Prolonged exposure to these products can lead to the staining. The discoloration is due to the saliva constantly breaking down from that difference of the neutral and the acidic pH. The color of the stain is brown and cannot be completely removed with daily manual brushing. In that picture in the corner is what the brown deposits can look like on teeth. Calculus buildup is associated with the frequent exposure to the chlorine, which can cause a yellow and brown residue and can form into calculus deposits over time. When the calculus formation and inflammation is combined, it can cause irritation that can damage the oral cavity and can potentially lead to periodontal disease. Dental erosion can occur. Demineralization begins at a level of 5.5 pH or below, and caries can start to form at a level of 6 or 5.5 pH. If the pool is maintained at a level of 7.4 pH, then it is in a neutral and safe state. Chlorine gas is very acidic, and that is sometimes used in large and old public pools due to how accessible and affordable it is. But most pools today use chlorine mixed with a base, and it's very important that the water maintenance is completed by a professional because if not enough base is used with the chlorine, then the pH of the water can cause the tooth structure to erode and dissolve. And that picture up here in the corner is tooth erosion due to an improperly maintained chlorine swimming pool. Pain and discomfort can also occur. Some athletes engage in a combination of swimming and heavy weightlifting or swimming in deep waters in general. These athletes that have caries, restorations, cysts, or a history of dental surgery are at risk of parodontalgia. This is a dental pain associated with the pressure and the strenuous activities of deep waters and heavy lifting. Encouraging athletes to not overwork themselves to avoid this is very important to keep the stress off of their mouth and especially to avoid complications further down the road. Prevention and counseling. Maintenance teams should always use chlorine in the correct amounts. When they're not, they can cause a lot of harm to a person's teeth, skin, eyes, and body in general. Appropriate chlorine concentration levels are 1 to 3 pounds per million, and pool water should be at a 7.2 to 7.8 pH level. Every swimmer and their reactions to chlorine exposure is different. So it's important to talk to patients about their exposure frequency, whether it be 30 minutes a day or 2 hours every other day in chlorine pools when evaluating their home care and suggesting customized individual recommendations to each patient. Tips for swimmers include, of course, brushing and flossing 2 times daily, using a power brush for stain because that manual toothbrush isn't able to get all of the stain off, and the power toothbrush might help get more of that stain off. Brushing with fluoride toothpaste or fluoride rinse before swimming for protection and prevention. Techniques, talking to their coach about techniques for breathing and keeping the mouth closed as much as possible to reduce chlorine water exposure in the mouth. Not brushing immediately after swimming and using a baking soda or fluoride mouth rinse instead. It's important to not brush immediately after because the chlorine will soften the enamel, and if brushed, it will lead to erosion. Professional topical fluoride applications at routine appointments, and chewing gum containing xylitol. And here's my works cited.